afternoon. My name is Jagoda Rokicka, and I will talk about bridging the gender health equity gap. Before we dive into women's health, allow me to first explain why these issues are close to my heart. I've been passionate about women's rights from an early age. In my middle school in Poland, every week in our politics class, we had to present a piece of data along with our opinion. One week, I chose to present a now famous case of a woman who was refused abortion for a health-threatening pregnancy. She then went on to successfully sue Poland to the European Court of Human Rights. So after I presented that story in my classroom, I was bullied by both my classmates and the male teacher. I was shocked. It never even crossed my mind that this could be seen as anything else than a patient who was wronged by the system and refused essential care. In that very moment, the budding seeds of feminism planted roots in my 13-year-old heart. But I did not become an activist. Instead, my love for biology took over, and I pursued an academic career in life sciences. As a researcher at Chicago, and later as a PhD student at Oxford, I started noticing something peculiar, namely how underrepresented women are in sciences, and not just as research group leaders, but also as research subjects. As a result, women's physiology is understudied, and many of their healthcare needs remain unaddressed. It really motivated me to explore how the status quo can be changed, and I believe that venture capital has a really prominent role to play here. So what do we mean by women's health? What usually comes to mind first are the sex-specific conditions that affect women, such as endometriosis or female reproductive cancers. Perhaps less intuitive are the other two categories that contribute to the gender health gap. And these are conditions that affect women differently, such as atrial fibrillation or certain cancers, and conditions with higher prevalence in women, like hypothyroidism. Together, these three categories contribute to 56% of total disease burden for women. Maybe it doesn't come as such a big surprise then that despite living on average 6 years longer than men, women spend 25% more of their lives in poor health. And this has dire consequences not only on an individual level, but also the lost years of productivity have a negative impact on the economy at large. So what causes the gap? There are multiple factors, but it all begins with how we conduct science. First, research and clinical studies focus on male physiology. Historically, even animal studies were performed on male specimens. Then it's how we collect and process the data. But women also face systemic challenges and gender bias when trying to access care or even get diagnosed. Did you know that women are twice as likely as men to die of a heart attack? It's because the symptoms present differently in women and are often missed by the physicians. But at the end of the day, this all comes down to the funding disparity in women's health, which is simply inadequate when it comes to the prevalence of these conditions. I think it's a real shame and, frankly, a huge loss for the investors. And here's why. Women's health presents a largely untapped investment opportunity. Globally, there are 450 million women who experience menopause symptoms, 190 million women who are suffering from endometriosis. And yet, in the last 5 years, funding for erectile dysfunctions this surpassed the funding for endometriosis 6 times. On a global scale, addressing the gender health gap presents a huge opportunity for investment. It's a $1 trillion opportunity globally every year. But I think it's also important to remember that besides being a great business opportunity, investing in women's health is also a great way to improve our society. I've spoken to a number of amazing startups that aim to bridge the gender health gap. And I would like to highlight 3 of them which are currently fundraising. It's Novacav, which developed a medical device that prevents preterm birth. Paloma Health, which provides specialized healthcare services for patients with hypothyroidism. And Bone Health Technologies, which developed a device that treats osteopenia using vibration. I would like to encourage every investor in this room, and especially our male colleagues, because they constitute the majority of VCs, to explore the opportunities of investing in women's health, and not just because women-led companies generate 35% more ROI, but also because this is your chance to bring about real change, give back to the women in your life, and provide your daughters with a healthier future. And with that, I would like to thank you very much for listening, and I invite you to reach out if you would like to continue this conversation, or if you're interested in getting connected to any of the startups. Thank you.